Hello, everybody. Thank you. And my name's Pat Goegan. I work for the Indoor Air Contaminants Assessment section at Health Canada. And I'm a member of a team of scientists and researchers who work to understand the health effects of air pollution and what steps that we, not only as a government, but as individual Canadians, can take to improve the air in our homes. As part of the federal government, our team studies indoor air pollution and are always looking for ways to improve the quality of the air indoors. So as part of the work we do, we look for opportunities to speak to the Canadian public, whether at trade shows or conferences, directly through emails and phone calls, via social media, or making presentations. And so we appreciate the opportunity to be able to speak to you folks today. So today I'll be giving an overview of the guidance that we've recently published for use by jurisdictions that are interested in developing their own cleaner airspace for use during wildfire smoke events. Wildfires and the smoke that they produce are of increasing concern in Canada. It's been estimated that wildfire occurrences will increase 25% by 2030 and 75% by the end of the 21st century. So if these predictions are accurate, wildfire smoke is something that we'll be dealing with for years to come. Forest fire smoke contains a variety of air pollutants, which can vary depending on what is burned. Wildfires and grassland burning will produce different pollutants than fires that consume buildings and vehicles. But regardless of the source, all wildfire smoke contains pollutants that are associated with an increase of adverse health effects. So so as part of the indoor air section, myself and my colleagues work to develop information that homeowners, air quality professionals, and municipal and provincial governments can use to protect Canadians from the effects of indoor air pollutants. In order to solicit input and guidance from people across the country, Health Canada maintains the Working Group on Indoor Air Quality and Health, which is comprised of regional air quality specialists and representatives from the provinces and territories. This working group meets yearly to discuss priorities that are important to communities across the country and acts as a forum for Health Canada to share and distribute the information that we create. Now, this working group, along with other groups such as our Federal Forest Fire Working Group, decided that there was a need for guidance on developing community-based cleaner airspaces for use during wildfire smoke events. Now, while several provincial and municipal documents exist, a need was identified for federal guidance to be used across the entire country. So my presentation today will cover the potential pollutants of concern, guidance on selecting the building itself, the operation of the facility, suggested equipment and supplies, as well as direction for the staff that will be selecting, designing, and operating the facility. This guidance has been developed for use by the provinces and municipalities who have an interest in developing a community-based clean air space. However, as this information can be applicable to residential settings, the guidance also contains recommendations for individuals who want to take steps to protect their indoor air at home from outdoor pollutants such as wildfire smoke. So what are the pollutants of concern when dealing with wildfire smoke? Well, fine particulate matter, it refers to tiny particles in the air which can be inhaled and deposited in the lungs. PM2.5 refers to particulate matter that is 2.5 microns or smaller, and due to its small size, has the potential to travel deep into the lungs. Particles are a complex mixture of solid material like carbon or minerals with chemicals that can be on the surface of the particles, or in some cases, the particle can consist entirely of soluble material, which can completely dissolve once they're deposited on the surface of your lungs. Carbon monoxide is a pollutant that's produced during the incomplete combustion of organic material, and which has the potential to cause health effects and in the extreme asphyxiation. The primary source of carbon dioxide in indoor spaces is occupant respiration, particularly in a location where large numbers of people are gathered. Unvented or poorly vented fuel burning appliances can also be considered significant contributors, so the potential for elevated carbon dioxide concentrations in a cleaner airspace should be considered. Other pollutants of concern include polycyclic aromatic hydrocarbons, oxides of nitrogen, and volatile organic compounds, all which have their own health risks. There are hundreds of different chemicals that can be present in wildfire smoke, with their presence and concentrations dependent on what types of materials are burning. And two other important indoor parameters are temperature and relative humidity. And while these aren't pollutants, they must be considered and monitored along with the other pollutants of concern. Now, knowing that these pollutants and parameters are important, we need to look at what levels we need to aim for within a cleaner airspace. Particulate matter is an important component of wildfire smoke, which has no threshold for health effects. So the aim is to reduce the levels to as low as possible, with the goal of maintaining indoor levels that are lower than outdoor levels. Carbon monoxide levels should be kept below 10 ppm. This value is derived from Health Canada's residential indoor air quality guideline for carbon monoxide. Carbon dioxide should be kept below 1,000 ppm, which is derived from Health Canada's upcoming residential indoor air quality guideline for carbon dioxide. Temperatures should be kept below 26 degrees, and relative humidity should be kept between 30, 35, and 50%. The remaining pollutants that I've highlighted should be kept as low as possible. Although these individual pollutants are listed and identified, the provided guidance is aimed at lowering all indoor air pollutants as much as possible. Now, the building itself. When selecting or designing a building to be used as a community-based cleaner airspace, there's several characteristics to be considered. The building itself should be fitted with a heating, ventilating, and air conditioning or HVAC system that's capable of filtering the incoming air, controlling the temperature, humidity, and air exchange rate. The doors and windows should be well sealed to prevent pollutants from infiltrating into the building. It should be large enough to accommodate the expected numbers of people who use the facility, and it should be connected to emergency power. If the emergency power consists of fuel burning generators, they should be located downwind of the facility to prevent the exhaust from being drawn into the building. And to support and manage the operation of the building, it's important that a facility manager is identified who's familiar with the operation of the building and the HVAC system. It's important for the facility manager to have the tools for understanding the smoke conditions outside, as well as interpreting the monitoring systems of the building in order to properly operate the HVAC system. Now, as I mentioned, having a building with well-sealed windows and doors is important for keeping pollutants outside. However, in order to ventilate the building and control temperature and humidity, outside air must be drawn into the building, and therefore the operation of the HVAC system and its ability to keep pollutants outside is important, especially in the case of fine particulate material. To prevent infiltration of particles, the HVAC system should be equipped with the highest efficiency filters possible. Filters are certified using the minimum efficiency reporting value, or MERV, which is a scale that goes from 1 to 16 and provides an indication of what the filter is capable of capturing. For removal of fine particulate matter, a MERV rating of 13 or higher is recommended. Additional odor removing filters may be considered as well if the HVAC system is capable of handling additional filters. Now, it's important for a facility manager to understand the capabilities of the HVAC system, because as the chosen filter becomes more efficient or additional filters are added, this can create an additional load on the HVAC system, as more efficient filters require a greater pressure to move the air through the filter. It's important that the facility manager has the understanding to know what filters the HVAC system can handle and to make sure they're properly fitted so that the air is incapable of bypassing the filter. The HVAC system should have the ability to switch between recirculation and outdoor air intake modes. This allows the operator the option to switch to fresh outdoor air when the smoke levels are low and to use recirculation when outdoor levels are high. It's also important that the facility manager has an understanding of the air distribution and mixing within the building. Opening and closing of doors, the movement of groups of people between rooms, and the opening and closing of air vents can alter the distribution patterns within the building. Now, in addition to the building's HVAC system, additional air cleaning equipment may be considered. Permanent ceiling or wall-mounted air cleaning devices may be considered and installed, or appropriately sized portable air filtration equipment may be chosen for use. Several different cleaning technologies exist with different levels of effectiveness. Some air cleaners have the unintended side effect of producing ozone, which is a health hazard, and so it's important that air cleaning technologies are carefully selected. Air filtration equipment are available with high efficiency particulate air or HEPA filter, which capture particles in the same size range of the MERV 13 filters. It's important for facilities to have an understanding of where these units will be used to ensure that they're appropriately sized for the rooms in which they'll be located. And for both the HVAC system and any additional filter-based cleaners, it's important that a stock of filters be kept on hand and that the staff has the knowledge to know when and how to change the filters. So now that we know we're aware of what pollutants and parameters are important to consider, the guidance provides information on what monitoring technologies should be implemented. As I presented earlier, PM 2.5 levels indoors should be as low as possible with the goal of having levels indoors that are lower than outdoors. The results from commercially available PM 2.5 monitors can allow measurement and comparison of indoor and outdoor particulate levels to determine how effective the filtration system is. These monitors can also provide an indication of whether the HVAC filters require changing if outdoor levels are seen to be increasing over time. Certified carbon monoxide alarms should be installed throughout the facility and monitored routinely. Newer models of carbon monoxide alarms have a digital display that provides a real-time display of measured values. And a thermometer and a hygrometer can be used to monitor temperature and humidity, but these may be a component of the building HVAC system, and these parameters should be also monitored routinely. Now, along with the operation of the HVAC system, there's other considerations for maintaining good indoor air quality. Doors and windows should remain closed as much as possible, and the movement of people in and out of the building should be minimized. If possible, a vestibule or a staging area would be beneficial in a building, as it will prevent having doors open directly to the outside. In effect, a little hallway space can act like an airlock for the building. If the building has kitchen facilities with exhaust fans that require operation, try and minimize their use or plan to use them when outdoor levels of pollutants are low. Depending on the configuration of the building and the ventilation system, operation of the exhaust fans may unintentionally draw air in from the outside. And if dust accumulates, choose wet mopping and replacement of vacuuming to avoid resuspension of particulate matter up in the air. Now, the previous slides provide guidance for protecting the indoor air in large facilities. So that's the advice for the cleaner air spaces, the community-based levels. But however, some people may choose to remain in their homes during a wildfire smoke event. The conditions may not be dire enough to require evacuation or moving to a cleaner airspace, or otherwise people simply may want to take steps to reduce the exposure to wildfire pollutants in their home. So to address this, our publication also contains guidance on protecting your indoor air at home. It's important to reduce the sources of indoor air pollutants during a wildfire smoke event. So this means not smoking in your house and avoiding other forms of combustion pollutants, such as those from incense, candles, and improperly vented wood stoves. Wet mopping or using a HEPA filtered vacuum cleaner can be used to remove dust to prevent resuspension of dust in the air. As well, the use of cleaning products should be minimized. Much like the larger facilities I've discussed, preventing infiltration of outdoor pollutants is also important at home. Sealing windows and doors will help prevent infiltration of pollutants. If you're considering changing your furnace filter to one that's more efficient, consult your user's manual or talk to an HVAC specialist to make sure that you do not overload your furnace fan. And when possible, limit the use of your exhaust fans when you're not cooking. As I mentioned before, this can draw outdoor pollutants in from unintended places within the home. As well, portable air filtration equipment with a HEPA filter can be used to reduce particulate levels. Choose a filtration unit that's properly sized for your room that you plan to use it in, and then change the filters when necessary. Maintain your humidity at 30 to 50%, and make sure that you have at least one carbon monoxide detector installed in your home, preferably outside of your bedrooms. Now, outside of the guidance, to help people protect themselves from poor outdoor air, not necessarily produced by wildfire smoke, we've developed an infographic for residential use. This infographic format is one that we've had really great success with, and they're very popular both online and at presentations and trade shows. They allow visual graphical representation of the science, which can be put on your refrigerator or displayed in a workplace or a classroom. It's nice because they're double-sided, so they're French and English on both sides, so they're pretty popular. But in this case, our infographic provides much of the same guidance that I presented today, and it focuses on source control, steps you can take to reduce indoor levels, and different monitoring strategies to test the effectiveness of any modifications to your behavior. It also provides a link to the Air Quality Health Index, or the AQHI, which provides real-time information in regards to the quality of outdoor air and the associated risks to health. And information about the AQHI can be found at airhealth.ca. So in conclusion, it's important that people have access to clean air during a wildfire or any other event where the outdoor air is poor. Municipalities or other jurisdictions who have an interest in identifying and equipping a cleaner airspace can use the information included in our guidance to help direct their selection process and operating procedures. It's important to ensure that a building is selected that's large enough to house the members of the community planning to use it. Use the guidance to ensure that the mechanical ventilation system has the capability for filtering, cooling, and controlling moisture indoors, alongside appropriate monitoring of indoor pollutants and comfort parameters. It's important to staff the facility with people capable of understanding the operation of the building, changing filters, monitoring conditions within the facility, and making changes depending on the indoor conditions, as well as in response to increasing or decreasing outdoor pollutant levels. And when sheltering at home, many of the same principles of source reduction and ventilation apply. So our Cleaner Airspaces document is one of many different publications produced by the Indoor Group at Health Canada. Some of this information and links to several of our publications can be found online at the Air Quality and Health and the Improve Indoor Air Quality links. I've also included the links to the guidance document I presented today, as well as to the infographic on protecting your indoor air from outdoor pollutants. And so that's it. It's been my pleasure to present our work to you today, and I'm available if you have any questions.